Systolic and diastolic blood pressure are two components used to measure blood pressure, which is a critical indicator of cardiovascular health. Understanding these terms helps in interpreting blood pressure readings accurately. Systolic blood pressure. Systolic blood pressure is the higher number in a blood pressure reading and represents the pressure in the arteries when the heart beats and pumps blood out during each heartbeat contraction phase. It is measured in millimeters of mercury, mmHg. For example, in a blood pressure reading of 120/80ths of a millimeter Hg, 120 millimeters Hg is the systolic pressure. Diastolic blood pressure. Diastolic blood pressure is the lower number in a blood pressure reading and indicates the pressure in the arteries when the heart is resting between beats, filling with blood, relaxation phase. It is also measured in millimeters of mercury, mmHg. Using the previous example, 80 millimeters Hg is the diastolic pressure in a reading of 120/80ths of a millimeter Hg. The difference between systolic and diastolic pressure reflects how the heart and blood vessels are functioning. Systolic pressure indicates the force exerted on arterial walls when the heart contracts to pump blood, while diastolic pressure indicates the pressure when the heart relaxes between beats. Clinical significance. High blood pressure, hypertension, a systolic blood pressure of 130 millimeters Hg or higher and/or a diastolic blood pressure of 80 millimeters Hg or higher is considered elevated and may indicate hypertension. Persistent high blood pressure can lead to serious health problems, including heart disease, stroke, and kidney disease. Low blood pressure, hypotension. Low systolic and diastolic blood pressure readings may indicate hypotension. While low blood pressure is not typically as concerning as high blood pressure, extremely low blood pressure can cause symptoms like dizziness, fainting, and shock. Measurement and monitoring. Blood pressure is usually measured using a sphygmomanometer, which consists of an inflatable cuff wrapped around the upper arm and a pressure gauge. The cuff is inflated to temporarily stop the blood flow in the artery, and then slowly deflated while listening to the blood flow sounds with a stethoscope, auscultation, or using automated devices, oscillometry. Blood pressure readings are expressed as systolic over diastolic, e.g., 120/80ths of a millimeter Hg, with optimal blood pressure typically being less than 120/80ths of a millimeter Hg for adults. Understanding systolic and diastolic blood pressure values helps healthcare providers assess cardiovascular health, make treatment decisions, and guide lifestyle modifications such as diet, exercise, and medication to manage blood pressure effectively.